Community Health Worker Training, Cardiovascular Health and Diabetes. Mini-Module 7A, Diabetes Definition, Risk Factors, Prevention, and Diagnosis. Learning outcomes for this mini-module: be able to define the term diabetes and the 3 types of diabetes, identify the causes of diabetes and the long-term dangers, be able to identify the risk factors and warning signs associated with diabetes, and become familiar with strategies for preventing diabetes. So what is diabetes? Diabetes is a disease in which too much glucose or sugar is in the circulating blood, and for that reason it's sometimes referred to as high blood sugar. Click on the link on this slide and then scroll down to the video to watch it. This will give you a visual image of what happens in the body when someone has diabetes. And then when you come back to the mini module, I'll break down the steps for you.
Your body uses glucose for energy. Glucose metabolism requires insulin, a hormone produced by your pancreas. Here's how normal glucose metabolism works and what happens when you have diabetes, a disease where your body either can't produce enough insulin or it can't use insulin properly. The food you eat consists of 3 basic nutrients: carbohydrates, protein, and fat. During digestion, chemicals in your stomach break down carbohydrates into glucose, which is absorbed into your bloodstream. Your pancreas responds to the glucose by releasing insulin. Insulin is responsible for allowing glucose into your body's cells. When the glucose enters your cells, the amount of glucose in your bloodstream falls. If you have type 1 diabetes, your pancreas doesn't secrete insulin, which causes a buildup of glucose in your bloodstream. Without insulin, the glucose can't get into your cells. If you have type 2 diabetes, your pancreas secretes less insulin than your body requires because your body is resistant to its effect. With both types of diabetes, glucose cannot be used for energy, and it builds up in your bloodstream, causing potentially serious health complications.
Okay, so let's take the steps one at a time. So the first thing to understand is that our bodies need glucose. And the food that we eat is broken down into carbohydrates, proteins, and fat. And carbohydrates are then broken down into glucose, which then goes into the bloodstream. The cells all over your body need glucose for energy. And insulin, which is made in the pancreas, lets glucose move from the bloodstream into the cells. Insulin is like a key that unlocks the cell to allow glucose to enter it and be used. Diabetics make too little insulin or none at all. Type 2 diabetics may also have insulin resistance, which means that the cells need more insulin to unlock them to allow the glucose in. So those type of diabetics need even more insulin, and they're not making enough. If diabetes is not treated, glucose builds up in the bloodstream because it can't get into the cells. And over time, high blood glucose levels can cause a whole host of very serious health problems, including heart disease, stroke, blindness, kidney failure, and limb amputations, such as amputations of the toes or the feet or even the legs. There are 3 different types of diabetes. In type 1 diabetes, the pancreas makes no insulin at all. In type 2 diabetes, the pancreas still makes some insulin, but either it makes too little or the body's not able to use the insulin well, and that's called insulin resistance. Or in some cases, both of those things are happening at the same time. And finally, there's gestational diabetes, which occurs in pregnancy and usually goes away after the baby's delivered. But gestational diabetics are at higher risk of developing type 2 diabetes later on. A little bit more detail about each type of diabetes. So type 1 diabetes used to be called childhood onset diabetes. Sometimes the child gets very sick when the diabetes first occurs. It's not unusual for them to end up in the ICU, the intensive care unit, at first. In type 1 diabetes, the pancreas produces no insulin at all. And therefore, somebody who has type 1 diabetes has to get insulin. So the treatment for them has to include insulin, and they may give it to themselves by injection several times a day, or they may be put on an insulin pump, which gives them small amounts of insulin constantly. Type 1 diabetes is usually unrelated to body weight, so it doesn't have anything to do with being overweight or being obese. And I have a picture here of a famous type 1 diabetic, Justice Sonia Sotomayor, who of course is one of our Supreme Court judges. In contrast, type 2 diabetes used to be called late onset or adult onset diabetes. It tends to occur later in someone's life rather than in childhood. However, with the increasing amount of childhood obesity, we are seeing younger and younger people developing type 2 diabetes. So nowadays you might see a 10-year-old or a 12-year-old developing type 2 diabetes, and they will be overweight. That would be why they were developing type 2 diabetes that early. What happens in type 2 diabetes is that the pancreas doesn't make enough insulin. It's still making some, but it's not making enough for the body's needs. Or in some cases, the cells in the organs all around the body become insulin resistant, so that the cells need more and more insulin to allow the glucose to get into the cell. And in some cases, some diabetics have both of those things going on at the same time. So in either case, they need more insulin than their body is able to make. Type 2 diabetics are often overweight or obese, and diet is a critical management of type 2 diabetes and of prevention, actually. Exercise is also really important because it helps to reduce insulin resistance in the organs. And type 2 diabetes may be treated with a very strict diet, or somebody may have to take either pills to lower their blood sugar or to control their blood sugar, or else insulin injections, depending on how severe their diabetes is and also how their body responds to medication. There's also a condition called prediabetes. And prediabetes is a condition that is sort of partway to diabetes, right? So it can lead to type 2 diabetes and heart disease. So if it progresses and it gets worse, then you develop diabetes, okay? So somebody who is pre-diabetic has blood glucose levels that are higher than normal, but not high enough to be called diabetes yet. And the definition of this, if it's being tested by a fasting blood glucose, meaning a blood glucose after you haven't eaten or had anything to drink for at least 8 hours, the numbers would be between 100 and 125 would be a diagnosis of pre-diabetes. And oftentimes these people are managed with diet and exercise to try to prevent them from going on and developing diabetes. So let's talk about the causes of diabetes and risk factors. So what causes diabetes? Well, for type 1 diabetes, we don't entirely know. There is a genetic predisposition. It seems to run in families. And then something happens at some point in childhood where the body has an autoimmune response. And what this means is that the body actually starts attacking its own cells in the pancreas, and the body itself destroys the cells in the pancreas that normally would produce insulin. Why that starts to happen, we really don't understand. Type 2 diabetes Again, we're not 100% sure of what specifically causes it, but again, there's a genetic predisposition, so it tends to run in families. And we know that in this case, environmental factors play a significant role, such as being overweight or being inactive or both. With gestational diabetes, we know kind of what the mechanism is. So during pregnancy, the placenta produces a hormone that's important for the pregnancy, but a side effect of the hormone is that it causes insulin resistance in the woman's body. And so with that insulin resistance, some women's pancreas can't produce enough extra insulin, and so they become diabetic temporarily until they have the baby and the placenta comes out, and then that insulin resistance goes away. So even though we don't necessarily understand fully the causes of diabetes, we do know what risk factors are. Genetics are the main risk factor for type 1 diabetes, and there's not much we can do about that. But type 2 diabetes has a number of risk factors, including some that can be controlled. So for instance, age. So people who are 45 or older have a higher risk of developing diabetes. Obviously, you can't control that. But obesity or overweight raises your risk of developing diabetes, as does physical inactivity. A woman who had diabetes during pregnancy, who had gestational diabetes, is at higher risk of developing type 2 diabetes later on when she's no longer pregnant. And that's also true of a woman who had a baby that weighed 9 pounds or more when it was born. A family history of diabetes is a risk factor, which again, you can't do anything about. However, somebody who has prediabetes, right, with the higher than normal blood sugar levels, if they get on a very good diet, if they can lose some weight, if they can become more physically active, they can reduce that risk, because that does definitely raise the risk that they will develop diabetes later if they have prediabetes. And then having high blood pressure actually raises your risk of developing diabetes. So if you have high blood pressure, you would want to make sure that you got it under control. And having high cholesterol, same thing, it raises your risk. So you would want to, do whatever the doctor says, whether it's diet or medication or both, to try to reduce your cholesterol levels. In addition, diabetes is more common among certain groups. It's more common among African Americans, Native Americans and Alaska Natives, Latinos, and Asian Pacific Islanders. Additional risk factors for type 2 diabetes and prediabetes. So I mentioned cholesterol problems, and specifically, it's if you have low levels of HDL, which is the good cholesterol, or high levels of triglycerides. And then high blood pressure, and then a condition called polycystic ovary syndrome, which only occurs in women. A woman who has that has a higher risk of developing both prediabetes and then going on to develop diabetes if she's not treated for that. And 9 out of 10 people with prediabetes don't know that they have it. So this is something that we can find out only by screening people. And it's a really good idea to have people screened, because if they have that, they can make some lifestyle changes that may reduce their risk of going on to develop full-blown diabetes. What are the warning signs? So most of these warning signs are actually signs of high blood sugar, right? So even after someone's been diagnosed with diabetes, if they have these signs, it may mean that their blood sugar is too high. So frequent urination, unexplained weight loss, and that's particularly true for type 1 diabetes. The opposite of that is more true for type 2 diabetes, which is weight gain. Lack of energy, increased thirst, blurry vision that kind of comes and goes, fatigue, which is a fancy way of saying you're tired all the time, and slow healing. And that's a sort of late sign. Hopefully some of those other signs are there. The person will be diagnosed and gotten into treatment before they have trouble with healing. Click on the link to hear a young woman's story about being diagnosed with type 2 diabetes and the changes that she's made in response to that diagnosis. And then when you're done, come back to the PowerPoint.
I'm Roxanne, and I have type 2 diabetes. I have a long family history of diabetes. So just as a routine physical, my doctor would check every year, just do the blood work and see where things were at fasting-wise. I kind of had an inkling it would happen when I was pregnant and had gestational diabetes. And I was kind of told at that point, hey, if you're not careful. And clearly my lifestyle choices were not the right ones at the time. Well, he told me, first of all, I need to start exercising. I needed to lose weight, and he was going to put me on a low dose of medicine just to kind of help bring the blood sugar levels down, to kind of keep any long-term complications from coming on as much as possible. At first, it was very difficult. I mean, changing your lifestyle is huge. I mean, most people think diet, oh, okay, I do it for a short amount of time, and it's really just changing everything that you do and incorporating it daily. So, yeah, it was hard at first. It's not anymore. But, 9 months ago, I was told, hey, you can come off your medicine, which was great. A totally different person. And even the people who know me see a totally different person. I love to eat far more than I love to work out, which was part of my problem. And now I can say I honestly like to work out. It's the first thing I do every day. I work out 7 days a week. Which it didn't start out that way. It was 3 times a week, and I dragged myself there kicking and screaming. And now I can tell when I don't work out, and I just don't enjoy my day. I'm an emotional eater, so anytime I'm stressed at work, or I travel for work, so it's hard to try and eat healthy when you're even on the road. I mean, you're just eating out of boxes all the time. I pack my own snacks, so I'll take almonds and granola bars with me. If I'm in a hotel where I have a fridge accessible, I'll take yogurt or buy yogurt at the store. And I try to scope out menus ahead of time if I know exactly where I'm going to be staying, and just it's a lot of research up front, but it pays off in the end. It can be a slow process because you are overhauling everything. Educating yourself is the most important thing, and knowing you and what works for you, what doesn't. And, just because exercise is probably the hardest thing for me, at least it was at first. And it was just finding something that I like to do, that I could stick with. Because most people will start gung-ho and then it'll die off. It's like a New Year's resolution. So just stick with it. I mean, over time you do see results. It may take a while, and it takes 110% of your effort every day, but you can get there. I think the last time I was at the doctor a couple of months ago, I was, down almost 40 pounds. I've obviously from working out lost several inches overall. I never had high blood pressure, but it wasn't the greatest that it could be. And I've had the best blood pressure I could. So I mean, overall, I am definitely healthier, and I feel healthier. There's quick fixes everywhere that they promise you, reverse your diabetes, or, lose 20 pounds in a week. And there are no quick fixes when it comes to this. It's time and energy and effort. But I wouldn't say I ever will reverse it, but I can control it. So that's what matters. It shouldn't be considered the worst thing ever, because it's not. It's very much manageable and controllable. You just have to educate yourself and take steps to make yourself better. No one's going to do it for you. You have to want to do it.
How can we help our clients to prevent getting diabetes? There are many things that people can do to reduce their risk of type 2 diabetes. They can't really do much about type 1, but type 2, they can do a lot. So starting with, get blood pressure screening done and get cholesterol screening done. And if either of those is high, you want to try to get them under control, obviously working with a physician, right? And in some cases, it's going to require medication to do that. You want to encourage people to do at least 30 minutes of physical activity a day, at least 5 days a week. Or if they can't keep to that schedule, 150 minutes of physical activity in a week, no matter how they break it down. And it should be at least moderate level of activity where they can talk while they're doing it, but where they are breathing harder than they would normally be breathing. And that level of physical activity actually helps lower the risk of developing type 2 diabetes by 58%. It has a huge impact. You should help people to manage their weight and their BMI. So you're talking to them about a healthy diet, for weight loss, number one, and just a healthy diet in general as well. So in this case, to prevent diabetes, the healthy diet factors that we're talking about: decrease fat in the diet, have more fiber, more whole grains, more fruit and vegetables, lean meats, other lean sources of protein. You really want people to reduce their simple carbohydrates, and simple carbohydrates are the white foods. So things like chips and pasta and white tortillas, so not whole wheat, but white tortillas and white bread, right? You want to really have them reduce those because the body takes those simple carbohydrates and converts them immediately to glucose. Whereas the whole grain carbohydrates get converted much more slowly and can help to maintain a more steady blood sugar. You also want to talk to people about watching what they drink. Alcohol converts right to glucose, certainly soda and fruit juice does as well. So really they should be mainly drinking water, seltzer, unflavored stuff without even diet flavoring, okay? And then if they are a smoker, quitting smoking. So how is diabetes diagnosed? There's a few different ways to do it. They all require a blood test. So sometimes they require just a finger stick with a drop of blood and can be done right in the doctor's office. Other times they'll draw a vial of blood and it gets sent off to the lab. It's a pretty simple blood test. In some cases, the doctor will decide to do a fasting blood glucose test, which requires fasting, meaning not eating or drinking anything other than water, for at least either 8 hours or 12 hours before the test. And if you're going to have that done or your client is going to have that done, they'll tell you how long it needs to be, whether 8 hours or 12 hours. And the test results are given in a number that really tells the amount of glucose circulating in the blood. So a fasting blood glucose test, the way those results are interpreted, if it's under 100 milligrams per deciliter of glucose in the blood, that's a normal blood sugar, so that person does not have diabetes. If it's over 125, that person has diabetes. And then if it's between 100 and 125, that's pre-diabetes. So that's higher than normal, but not so high that we would call it diabetes. Another test that is sometimes used to diagnose diabetes, and if somebody is diagnosed with it, it's also used to kind of help monitor how well they're managing their diabetes, is something called a hemoglobin A1C test. And this is, again, a blood test, and it gives a snapshot of what the average blood glucose level was over the past 3 months. So it's a very useful test because it gives an idea of how have things been going for the past 3 months, not just this morning. And you can see in this picture here, if the hemoglobin A1C is 6.5% or higher, that's diagnostic of diabetes. The person has diabetes. If it's below 5.7, that's a normal blood sugar. And if it's between 5.7 and 6.4, that's pre-diabetes. Now you can define the term diabetes and the 3 types of diabetes, identify the causes of diabetes and the long-term danger of diabetes, identify the risk factors and warning signs associated with diabetes, and describe strategies for preventing diabetes. The next mini module is 7B, management of diabetes.